Everybody, welcome to the Committee of the Whole meeting for June the 23rd, 2025. We acknowledge that we're on the traditional territory of our friends, neighbors, and Treaty 8 partners of the Fort Nelson First Nation, as well as the Prophet River First Nation. We recognize our treaty. We recognize the rights within that treaty. We recognize the Cascadeni Nation as well. And finally, we recognize the Métis people for living and their contributions in our region. Please be advised that tonight's meeting is available to the public to attend virtually and is being streamed and recorded. Council, do you have any additions to the Committee of the Whole meeting? Oh, staff? Thank you. This is a public comment period. Is there anybody online who wishes to speak to tonight's agenda? Anybody in the gallery? No. Everybody's okay with the agenda the way it is? Okay. So that brings us to petitions and delegations, and we're lucky to have Julie Rogers back from Julie Rogers Consulting. She has our communication strategy. I think she's got it in final form and prepared to present it to us. Welcome, Julie. Good to see you again. The floor is yours.
There, that works. Oh, and there we go. Thank you. And I can't control it, but you can. Is that what we're doing? Okay. Oh, we're here. Thank you. You've all
You're gonna have to move the
copy.
mic a little closer, I think,
Yep.
please. Thank you.
You should all have a copy of the communication strategy. So I'm going to just briefly go through it with you. So first up, next slide. We will talk about what we heard and who we heard it from, some principles in effective communication that are in your strategy, and then I'll give a quick overview of the 4 goals attached to the strategy and the role of council in achieving the goals in the strategy. So first off, what we heard. There we go. Next slide. There we go. We heard from council. As you remember, I had a meeting with you where we talked about communications. We had a good lengthy conversation about how you see effective communication working in the municipality. I've had several meetings with various staff, met with the Chamber of Commerce, the library, and the Literacy Society staff. We also did a community survey and a staff survey on communications. What we heard, next slide, was overwhelmingly throughout all of the audiences, communicate early and communicate more often. Provide clear, consistent, and meaningful information, and help keep our small town feel. They want communication to be effective and timely for the information that people want to know. Sometimes I think when we in government, we are so focused on our jobs and we think like the manager of whatever, and oh, I need to make sure I tell people this. But remember to think like a citizen, and remember to think like, well, what will people be most interested on this? And so to help keep that neighborly small town feel. So next slide, our principles and vision. So first off, our vision, as stated in the strategy, is to be an informed community and responsive employees who listen, share ideas, and collaborate to shape the municipality's future. I think it's a really, really important vision, and it says a lot about working together and being responsive and listening. And the listening is really, I think, some of the most important work that we do as a municipality, because we can't respond to our citizens' needs if we tell them what we think they want. Our mission to establish a framework that strengthens the municipality's communication capabilities, enhances relationships, and implements effective communication programs to achieve organizational objectives. It's really important in communications that we are tying back what we do to council strategic goals. Like what are the goals of the municipality and how are we utilizing our partnerships, our relationships and our communication to achieve those objectives? On our principles, provide timely, accurate, clear, accessible, and responsive information. The accessible is the really important piece there. That is more than just alt text on images. That's the tone that you use, the language that you use. It's ensuring that you're using plain language and not jargon. There's a lot just in that one basic principle. The second one, use appropriate communication tools for each situation. That means if we're trying to communicate with our seniors, we're not tweeting it, right? Things like that. Third, collaborate to ensure thorough, factual, and timely information. Respect citizens and employees' access to information and privacy rights. Support engagement opportunities to inform public policy. Really an important piece. And we talk about engagement, but is the engagement actually informing public policy? Are we listening? Promote culture of two-way communication and excellence in practices. And so just promoting that across the organization. Sometimes we go, oh, we have a communications person. Yes, you are so fortunate. You not only have the FTE, but you have excellence in communication among the staff that are managing your communication. But the important piece is to promote it across the organization because your communications staff can only communicate that the road is closed if somebody's told them the road is closed. So ensuring that we have that understanding of the importance of communication and these principles throughout the organization is really important. So we have 4 goals in the strategy. The first one, ensure that all government actions, policies, and decision-making processes are communicated clearly and openly to build public trust.
So I have a question on that one.
Yeah.
How do you reconcile that with the requirement for our in-camera session?
Well, in municipal government, we go in camera for very, very specific reasons, right? It's the legal, it's the personnel, and we still communicate that. We still tell the public we're going in camera on this date at this time to have a conversation about legal issues. And after the meeting, if there are items that can be made public, they're made public, but we do tell the public that we're doing it.
So that's the decision-making process then?
Yes.
Okay.
Yeah. And there's quite a bit of detail in your strategy about how we achieve this goal. I'm not going to read the report aloud, but ensuring that internal protocols, standards, and communications channels, right? Really taking care of all of the pieces on the how we do it. Planned proactive communications, things like keeping a communications calendar for things that we know that happen every year, getting ahead of the message, communicating that the road will be closed before the road is actually closed. Council outreach, wherever possible, having council perform some outreach to the community, and having council report back on what they're hearing so that the municipality can be responsive for you to come back and say, hey, we had this, coffee with the mayor event, and I heard a lot of people talking about this. Maybe we could do some more communications on this issue. It appears people are really interested in it. And utilizing partnerships. You have some very active community organizations like the Literacy Society and the library, and how can you use those to help amplify your message to the community? So, and the second goal is foster interactive and accessible communication channels that promote active involvement, meaningful dialogue between residents, community partners, and local government decision makers. So it's that talking and listening piece. We're not on a soapbox, we're having a conversation. And what do those partnerships and relationships look like? So how do we get there? A mobile app would certainly be helpful in reaching a lot of our citizens. More content creation, like video, using radio, creating explainer videos, doing live Q&A wherever possible. So these are more of the proactive storytelling kinds of things. Ensuring we have good relationships so that you can contact the library and say, hey, in your next newsletter, could you include this information? Because you've developed that relationship with them. Focusing on resident needs, what they want to know, what they need to know. Creating an engagement page so that if I'm wondering what's going on at City Hall, I can go to a page on the website and see that there is a survey out about this issue and there's an upcoming town hall on this issue. Council report template, include in every report how this item will be communicated so that in everything that comes to council, staff are thinking about, well, not only do I need you to make this decision, but once you've made the decision, this is how it will be communicated. And performing a bit of fact check. So when there is misinformation in the community, how is that being addressed in a fact check way, whether it's a page on the website where here's the rumor, here's the information, or if it's, a Friday post on, debunking rumors, but addressing misinformation wherever possible. The third goal, showcase local initiatives, success stories, strategic partnership to boost business development, create jobs, celebrate the community's quality of life and pride. This is what some people call the fluffy stuff, and I call it the really, really vital stuff. It's helping the community understand what happens at Municipal Hall, what people do every day. You have clean water every single day. Have you ever wondered how you get it? Have you ever wondered what happens when you flush the toilet? Have you ever wondered how a pothole forms? Because in the north, we get a lot of complaints about potholes, but those are not the same potholes that were there last spring. They're brand new. Let us explain. And here's how we deal with them. So celebrating what we do and celebrating the successes in our community, the achievements in our community, and sharing that information, even when it's just, we've signed an agreement with this other organization to provide this service better. That's worth celebrating. You guys do a lot. And it's a little bit about showing off, and helping people to understand what the municipality is all about, what the local government is all about, but also building some community pride, because there's a lot to be proud of, but not everybody necessarily knows. So how are we getting there? A spotlight campaign, some kind of a regular campaign that shines a spotlight on the things that you do, using multiple channels. So if you're creating a video, is it going on YouTube? Is it going on Facebook? Can you show the video at the next town hall meeting? Collaborating with partners so that maybe they share the video or the information. Contributing to local channels. Are there opportunities on other social media channels or other newsletters to showcase some of the information that you have? Responding to resident needs with helpful tips to build the audience and the trust. So we don't always have to go to Facebook and say, please be advised, this XYZ, we've changed our bylaw and now you can't park here. We can go to the public and say, hey, winter is coming. Do you know how to install heat tape if you live in a trailer? We have a video that we made showing you how to install heat tape. We will show you how to check your backwater valve so that you can make sure when we flush our sewer system, you don't get your toilet exploding, which sometimes happens. So little explainer videos, helpful things that will build your audience, and it will help to build trust, because this is information you guys have. And sharing it establishes you as experts. A package for new businesses and stories, just stories like, this is Bob, he mows the lawn at all of our parks. This is what he does all summer long. This is how long it takes to mow the lawn. This is the pride that Bob has in the work that he does. Neighborly and helpful, and it helps to build the audience, helps to build trust. And your final goal is to publicize the government's innovative approaches to enhancing public safety, environmental stewardship, and infrastructure development. Some of the most important work that you do. And you've been very innovative. You're a small community, but you're a small community that has really accomplished a lot. You are innovative and you've got a lot to be proud of. So a lot more publicizing of the really cool stuff. Even just to talk about asset management, because we talk about it at budget time. We always talk about, oh, well, we've got aging infrastructure and we need to be careful. Yeah. But you're doing things. And so publicizing the things that you're doing to taking care of your assets and things like that. How do we get there? NFT, policies, guides, video, social media training, social media strategy. All of these things will require resources, and we're going to talk about that right now. So the role of council, two things. Well, three. Sharing. When the municipality puts out information, it is so helpful if council shares it. If there's something that the municipality has put on Facebook, share the Facebook post, share the Instagram. If you've received an email and it's good information, share it with your network so that people know what's going on. We're getting that information out, right? All of those stories, all of those successes, the information that they need to have. But it's also helping to point people back to the municipality. So when they read something on social media, not your channel, and they go, that's crazy. I can't believe we've just passed a bylaw that says you're not allowed to park downtown at all anymore. They'll know that they should check the website and find out that's not true. Right? We want people to know where the source of information is, and having council actively promote the information that we're trying to put out, but also point people back to the official sources of information. It's very helpful. And then the other piece is for councillors to stay on message. If the municipality puts out ABC, those are the messages that you can share. But if you're asked to do an interview about ABC, talk to communications staff, because they will predict the questions that you might get asked. They'll find out from the reporter who else is being interviewed, so they've got a better sense of the context. They will find out the questions, if possible. Not all reporters will give you the questions, and they'll give you the key messages. They said, you got the information that went out from the municipality, but now you're preparing for an interview. So they're going to help you think of all of the other things that you might get asked and prepare those answers. And then you can do the interview, and they will listen to the interview, and they'll give you feedback on how you did. If a council member is doing media interviews and doesn't have that support, things can go terribly wrong. You can have a situation where you say something that you thought was true yesterday, but actually more information came to light today and you didn't know. And so you've perhaps shared some incorrect information. And there are a lot of, take 5 minutes Googling council apology or councillor misinformation or mayor misinformation, and you will find a number of stories. I'm sharing 3 with you. This third one is a Saanich councillor that publicly accused staff of something that turned out to not be correct. So your staff's job is to support you. And so we let them do that with glee. I'm actually going to skip that one. Thank you. Because if you misspeak, and in my career, the number of times with excellent intention, a local councillor or mayor has said something that they thought was true, but they didn't have their update yet. And so they thought it was true. It wasn't true. We had to put out correct information. And then 2 or 3 years later, somebody will say to me, oh yeah, but I remember the mayor said this. Corrections don't travel very fast. The original statement travels really fast. So one rogue quote can derail your entire strategy. And it can cause reputational damage. And it can cause wasted staff time. So rather, when someone comes to me and says, I saw an interview with this person and I think this information they shared might not be correct. I've got to find the story. Then I've got to call the staff involved and find out if it was true. And that in many cases, that staff person is super busy because they're calming down all of their staff that know that there's information out there that's not correct. Then they're contacting the reporter and asking the reporter if the reporter could please make a correction. At that point, the reporter has a choice. They can update the story that's already been read by thousands of people, or they can make a new story that says, counselor was wrong, counselor lied, staff has to correct counselor, and they can make it a thing. And they don't always, they're usually pretty kind, but oh yeah, I can understand how they might have gotten that wrong. Sure, I'll update the story. But a whole bunch of people have already read it. So that's where your staff are now spending their time, when what we really wanted them doing was making a really cool explainer video, or a video like Fort St. John has about not pooping in the pool. It's awesome, right? So we want our staff doing the things in the strategy, and you could help with that, helping amplify their message and let them help you when you've been asked to give an interview. Even if you've been asked to do a presentation at Rotary, they'll help you. They want to make sure that the messages are the same as the messages that they've been putting out, so the information is accurate and timely. When limited staff resources are putting out the fire, they're not creating content, they're not being proactive, they're not monitoring social media, which is something that they do regularly, is especially when they've put out information that might be controversial. They're monitoring social media to make sure we're addressing concerns that the public has put out there. And they're not telling those big success stories. And that's something we want them to do. So future needs. And this is in your strategy, you've got some goals, you've got some measurable objectives, you've got some action items. This is not tomorrow. This is over the next couple of years as time and budget allow. And so these are things that may come to you as time allows. Perhaps an engagement platform for the website. It doesn't need to be a super fancy one. There are inexpensive ways of going about it, but there is definitely a cost. Video capabilities. Yes, we can make a simple little 30-second reel from our cell phone. If we want to do something a little bit fancier, we might need to invest in a camera. We might need to invest in video editing software. A municipal app would be a handy thing to have. You have the Voyant Alert for emergencies, but an app where people can report things to the municipality. They can report a pothole, they can report a traffic light, street light out, and you can push information out to them. When there's an event, you can push the schedule out through the app. When there's an event like, a public event, this is what time lunch will be served. This is when the speeches are, can all go out through the app. But also a water shut off could go out through the app. Updating the website so that you've got emergency banner at the top, so that you maybe create some of these pages that we've talked about. And I know you have already invested in the website and there are some changes coming, and that is fantastic. Especially, I think the timing is excellent because now that staff's got a strategy in front of them, some actions, they can really think through what the website, what they can accomplish now, and maybe what future capabilities are for that. Social media management software. Sorry, I added that to my list after I sent you the slide. You do have some social media management software. It doesn't give very good data, and it's not as easily used as some of the other ones. So a social media management tool would be something to consider, and feedback loops. ways of gathering information, which might be something embedded in your engagement platform, and it might be something completely separate. And then the cross-training piece. Imagine you have a crisis and you have two people who normally manage your social media and your website. One's in the hospital and the other one's in Mexico. So having that cross-training in the organization, partly so that everybody gets it and they understand the strategy and they can feed the information that is needed to communications. But the other piece of it is sometimes we need to be able to step in and help out. And to understand that things move really quickly. So this is your strategy today. These are the resources that we've identified that you would be nice to have to achieve these goals over the next few years. But we also need to keep in mind that to reach 50 million people, it took 75 years to adopt the telephone. It took 38 years for 50 million people to adopt the radio, 13 years for 50 million people to adopt the television, 18 months for 50 million people to adopt Instagram. And I will put a little caveat on that. It's probably because we had the internet, so the information about Instagram existing was really easy to spread. But Threads, new social media platform, had 50 million users in less than 24 hours. ChatGPT had 100 million users in only 2 months. So keeping in mind that technology and social media is changing really, really rapidly. And your staff are also trying to stay on top of that. Threads came out and we were all like, do we need to be on that? And if we do need to be on that, how do we do that? How does it work? Who's on it? How do we use it? And so staying up on top of the changing landscape is taking up some staff time too. But that's going to cause updates to your strategies, as it should. Even things like AI, that will probably create an update to some of your policies because the world is changing very, very quickly. And I'm happy to answer your questions.
Well, thank you very much, Julie. I appreciate the work that you've put into this. I read it over a couple of different times, and really the only question it generated was the one I asked about going in camera for me. But does anybody else have any questions that might want to ask Julie? Councilor Roper.
What advice would you have for the individual counselor? Let's say if they feel the communication strategy isn't being followed or the decisions aren't being informed by the engagement being conducted with the community. What should the individual counselor that feels differently than the rest of the council, how should they communicate with their constituents when the messaging from the organization is completely different from how they feel?
Part of that is certainly up to your council code of conduct. And then the other piece of it is the municipality is communicating information. They're facts. And so individual counselor might have a different opinion on how council arrived at a decision. And that's up to that individual counselor to decide how to communicate that. But the municipality is simply communicating that the decision was made. Municipality is not taking a side. That's between councillors. But generally, when a council has made a decision, that council now owns the decision. And moving forward, usually the statements from a councillor will be, well, while I opposed this and stated why at the meeting, this is now a decision of council. And so we will move forward together and I hope it goes well. I mean, you don't hope it fails, right? So it's, it's challenging when you're opposed to something and it's going through anyway. You can continue to remind people how you voted, but the municipality owns it and council is the municipality's governance body. So Sharing the information that comes out from the municipality is certainly helpful. But as an individual councillor, all you can do is talk about how you voted.
Anybody else? Okay, next steps. What are we gonna do with this strategy? Are we, I mean, my idea would be for staff to come back with, I mean, there's obvious some things in here that are low hanging,
Yep.
pretty easy to do. Some things be more difficult, take some time to sort of get them implemented. What are your thoughts on coming back to us with sort of that timeline maybe?
Yeah, so we've kind of mapped the objectives and activities into a work plan to get a good sense of time and capacity, and then also being mindful that for a good chunk of the year, the capacity is divided with the EOC. But also then looking at what we might have available for budget in any given year, and just trying to think into future years what some strategic investments might look like to advance the various goals within the plan. So there's definitely some things that are easily accomplished, and we've started to implement them already. But then there's going to be some others where there might be a bit of a small plan around that, like the innovation. I can never remember the word that you used to describe it.
Neither can I.
But the kind of the innovation platform where we start to showcase the cool things that we do as a local government, like that might take a little bit of a mini plan to gather the ideas and create the content. And that's something that you can do in a planned approach, but there's other aspects of the plan that you're going to have to integrate that into our everyday work as we go along. So we can certainly, take a better look now that we've kind of had this conversation, and we were waiting to see where it landed with council as well before we started to really run with it, but bring it back in terms of a timeline, what some potential investments over the next 3+ years might look like, and what we can reasonably accomplish with what we have today.
Yeah, I saw, in the report, I saw a lot of things that we're doing, right? And then I saw this sort of funneling it all sort of into this strategy. And so I think it's good. And I think if you can come back to us with a bit of a timeline of what it's going to take and what resources you need, and council can decide if we want to speed that up by giving you more resources, right? So I think that would be a good next step, I think. And whenever you can get that to us, we are communicating, and we are communicating well. We just want to be excellent at it. And so, I think that's going to be based on staff's timeline on what you're doing this summer and how you can pull this together and decide what you think you need to do early and what we can help you with. So good. Julie, please.
I would just offer one caution on establishing the timeline. It's always good to do. But in communications, those timelines are like your road project and it suddenly rains. We can go, well, in Q4, we're going to hope we should, we've got nothing else planned. So we're going to do this and this and this. We're going to create these videos. But in Q4, something happens in the community and all of a sudden you're dealing with a crisis and you don't even start it. So we always have the best of intentions and we talk about, things we're going to do in each quarter of the year, but we're also very responsive. And so in responding to the community's needs, sometimes that means we're not being proactive on other things and we're not accomplishing some of the things that were in our work plan. It happens. But yeah, that's the sort of the fluid nature of communications.
Yeah. And my plan idea would be short-term, medium-term, long-term. That's the timeline I'd be looking for as opposed to quarterly, Okay. Okay, Julie, thank you very much for the work that you've done. I'm sure you'll bill us accordingly, and staff will look after that. Okay.
We will note that we took advantage of Julie's time because she came back through a grant to offer crisis communications. So
Nice.
so she's here with us tonight, kind of as a double up on that. But yeah, you'll be spending some time with her tomorrow as well for that
Perfect.
topic.
Looking forward to that. Thank you very much, Julie. You're welcome to stay. Okay. Our next delegation is Julianne Kucharin from Urban Matters. She's here to speak to us a little bit about the Community Health Plan Steering Committee and the work that that they did last year and their plans for the upcoming year. Welcome.
Thank you, Your Worship. Thank you so much for having me. Hello, everyone. I am super grateful to be with you this evening. I'm sorry I can't be there in person, but calling in from the traditional territory of the Lheidli T'enneh First Nation, so otherwise known as Prince George. And I've had the pleasure of meeting many of you who are in the room. And for those I haven't, thank you very much for having me. I look forward to meeting you in person at another time. So yes, as Mayor said, I've been invited to walk through the Northern Rockies Regional Municipality Community Health Plan Steering Committee and implementation work from this past year. And while this work has been going on for the last 4 years, we're going to focus mainly on what we accomplished over the 2024 to 2025. And sorry, am I sharing my screen or is someone else sharing? I don't see anything.
What's easier for you? We have it up, but you'll have to tell us when to advance.
Okay, because I won't be able to see it. Gotcha.
Well, yeah, so no, you'll see it. Do you want to share yours? So is that easier? And then you have control, Julianne.
I'm happy to let it or to tell you guys to
Okay,
to switch it. I just don't see anything yet, so I didn't know if it was shared.
it's going now.
Okay.
Can you see it now?
Double click. Oh, here we go. Okay, perfect. So yes, next slide then. Great. So for today, I will start by giving you a bit more of an introduction to Urban Matters as a company and what we do. And then I'll provide a bit of a background into the project itself and provide some context for the rest of the presentation and some of the work that we've covered off. And then I'll walk you through the main initiatives and tasks that the Community Health Plan Steering Committee undertook and the major milestones and deliverables that were developed. I'll briefly touch on what can be expected for the next 9 months in terms of what the group is focusing on, and then we'll leave a bit of time for questions or comments at the end of the presentation. Next slide, please. So who we are. So yeah, I'm not sure how many folks in the room have really gotten a chance to understand all about Urban Matters, but we are the sister company to Urban Systems, which I believe you're all familiar with based on all the engineering work that we do together. But yes, Urban Matters is a community contribution company. And so what that means is we are mandated by the CRA to reinvest a minimum of 60% of our profits as a community contribution company back into the communities where we work. So when we were created, we weren't profitable yet, so we weren't reinvesting any money back into community. But as of last year, we were able to invest almost 300,000 back into community initiatives with the communities that we work. So it's a pretty cool model. And the origin story of Urban Matters is pretty interesting. It was an engineer in our Kelowna office of Urban Systems around 2022 that had a bit of an epiphany or call to action that a lot of the work that we do within Urban Systems, he didn't really feel like it was meaningful enough in the fact that it was really addressing the big complex challenges such as mental health, substance use, homelessness, and things like food insecurity. And so, yeah, that Urban Matters was born out of that need to really also address other things beyond just the infrastructure and building, which of course is also very important. But yeah, how are we addressing these complex challenges? So through convening, facilitating, and listening. Next slide, please. So myself, Julianne, I'm a health and social planning consultant. I'm a registered professional planner, and I've had the pleasure of working with the Community Health Plan Steering Committee. We're in our 4th year of work together. And my colleague, Graham Snow, who is also a big part of this project. He is currently on Haida Gwaii, paddling around Gwaii Haanas right now, which is why he can't be with you tonight. I'll let him know that he's really missing out and he shouldn't be on Haida Gwaii. But Graham, yeah, so we've been fortunate to have other supporters with this project. Anne Burrell, who is also with Urban Matters, stepped in for a year while I was on maternity leave, and Sarah Chitwa, who used to be with Urban Matters, also was a big part of this project for a couple of years. And we are lucky to have a new planner, Sydney Elliott, who just graduated from UNBC as a community planner, will also be supporting this work in the future. Next slide, please. So our role on this project, we have several kind of key responsibilities that we undertake. We coordinate and facilitate monthly committee meetings. So we get the group together, we work through an agenda, we have the group share updates for what each organization is doing and what they're focusing on in terms of health and sharing back. And then as Urban Matters, we also update and action some of the key strategic documents that the CHPSC, we call it, but the CHPSC, which would have been defined prior to showing you the acronym, but we flipped slides a bit. So yes, you will learn more about this group. And so we really update some of those key strategic documents. We lead a lot of the various work plan initiatives and research that is associated with the main strategic objectives that the group kind of signals to us that are the most important to be working on. And then beyond the research, we also develop different resources for the group depending on the topic. So it could be reports, handouts, pamphlets. So it really depends on the audience that will be receiving the different documents and what the most effective medium would be. And then we also just manage other tasks as they come up from the group throughout the year. And as I previously mentioned, we're thrilled to be in our 4th year of supporting the Community Health Plan Steering Committee and the implementation of their health plan. Next slide, please. So project background, I believe many of you or you all would have some of the information from the report that was given to you, but essentially the Community Health Plan Steering Committee, it was initiated following, some really robust community engagement around healthcare in the region. And so many residents were engaged. It became clear that, a formal group should be formed around various actors, stakeholders, organizations coming together to really focus on health-related initiatives. So the steering committee was established in 2017, and it's always been a tripartite agreement, which is, I think, really unique and really special about this project. The fact that the yourselves, the regional municipality, as well as Northern Health and Fort Nelson First Nation all coming together as 3 entities really supporting and focusing on this work, I think is, a testament to how powerful, these initiatives can be when all the groups come together. And so right from the start, from 2017, the areas of focus for the group have been recruiting and retaining healthcare providers, improving healthcare travel services, improving maternity care locally, increasing visiting health services, including virtual care, improving cancer care locally, and improving mental health and substance use services. And so while the wording of those kind of 6 focus areas have kind of changed and evolved slightly over the last 8 years, those kind of big priority areas still remain true. And throughout the years, the community health plan was created right away in 2018 to look forward to 2020, and then was updated again in 2021, and now is updated every year annually with the work plan. But we see the same kind of priorities come up year after year because, as you all know, as being residents from a small northern community, these continue to be priorities. So I'll also say that as, again, everyone in the room knows, healthcare isn't the jurisdiction of local government, but I think it's really unique that yourselves and the community have really focused on making health a priority and advocating in the ways that all the groups come together to do. So I think it's that's a really special part of the project. Next slide, please. So in the years before 2024, there were various ways that we would come to focus our efforts over the year together. But in, I guess it would have been the end of 2023, early 2024, our colleague Anne Burrell and Sarah Chitwa took the group through a big priority setting exercise to really focus and narrow in on a couple main priorities, because we were finding with the group over the couple of years before that everyone was kind of passionate about the various 6 areas in different ways, and it was sometimes hard to really narrow down how the group was approaching the different initiatives for each priority area. So the group decided through dotmocracy, so everyone having a bit of a opportunity to weigh in on what was most important and how they wanted to center some of the work. The 2 that kind of rose to the top were increasing efforts to recruit and retain healthcare providers, so really focusing on growing our own in the Northern Rockies Regional Municipality and focusing on folks who kind of grow up and gain education to kind of stay in a community and be able to work in the healthcare sector. And then the other big priority being improving healthcare travel services. So thinking about how, as a regional municipality, you can advocate for increased access to non-emergency health travel services. So those were the 2 objectives that kind of led all the work that came out of the 2024 to 2025 year. Next slide, please. So I'm very pleased to be able to share some of the big, I guess, milestones and outcomes that came from the work over the 2024-2025 year. So as all of you would have been privy to, because you would have met with some of these students from the UBC medical department, but UBC Medical has a program around the healthcare traveling roadshow. So they travel to various rural communities within BC to address the workforce shortages in rural healthcare. And so in May 2024, you would have had med students tour the hospital, meet with yourselves, meet with Fort Nelson First Nations Chief and Council, and then they would have met and presented to high school students. And so, that would have been organized largely through yourselves at the regional municipality, but then, making sure that all those students are meeting with the right people through Northern Health and Fort Nelson First Nations. It was really a collaborative effort through the steering committee to make sure that the students got kind of the most beneficial visit to Fort Nelson. And I know Diana had shared with the group how much of a great impact and impression there was on a lot of students, and some of them even talking about how they really aspired to be like some of the doctors in the area. And so it was just a really impactful event, I think, for everyone. Next slide. And so also the Rural Coordination Center of British Columbia in 2024, they organized and hosted a province-wide rural health dialogue, and local municipalities were invited to bring folks from their region to Vancouver to get kind of trained and updated with some of the initiatives and also some of the ways to engage with local citizens around healthcare and rural healthcare in particular. And so Urban Matters was encouraged by the steering committee to go down and liaise with RCCBC and then come back up and host a rural health dialogue with residents in the regional municipalities. So that's what we did in December. We had an in-person engagement event. We hosted it at the visitor center there and had dinner. and had about 15 participants join in, and we had a really robust discussion on 4 key areas: health, service, transportation, education, and training for healthcare providers, recruitment and retention, and hybrid healthcare delivery. We asked, how things are going in those areas. What would you like to see more of in those areas, and what a desired future would look like? And so there was a lot of sticky note writing and lots of good conversation. And I know something that myself and your staff that were there, what really stuck out was just how much residents really appreciated having the opportunity to not only learn what the steering committee and the community health plan is all about, but also to be able to have some input and be able to have these discussions on some of the main healthcare priorities that are on the tops of everyone's mind. So we were able to get a lot of input, create a bit of a what we heard summary so that we could share back with the steering committee and kind of have some of that input also impact some of the direction with some of the work that we're doing. So it was really nice to be able to engage with the community in that way. Next slide, please. So another initiative that fell under that objective number 1, the recruitment and retention and growing our own, was the Expose and Inspire event. So as you all know, a local event that connects Fort Nelson Secondary School with professionals in the healthcare sector. So really helps students who are in high school to be able to know what they would need to pursue a career in healthcare. So whether that's course selections or thinking about where they want to study to be able to enter the healthcare field. So the event included a tour of the hospital. They were able to connect with various healthcare workers. So workers in medical imaging, like the picture on the screen, but also physio, talked to some registered nurses and long-term care practitioners. So a lot of different perspectives to be able to ask questions and see what that might look like to be able to enter the healthcare field. Because just from seeing over time, those who obviously grow up and want to come back or stay in Fort Nelson and the Northern Rockies Regional Municipality, just really creating those opportunities for students to get involved early in healthcare. So next slide, please. So another kind of big initiative for the Growing Our Own objective was to create an action plan that really is to be used as a living document. But what we wanted to do was have a comprehensive document that would allow us to add to areas where there's certain programs or there's opportunities for students to access things like funding or other grants, and the pathways again to be able to enter the healthcare sector. So really, how are we ensuring that our local residents and our local youth know kind of those pathways to be able to enter the healthcare sector as they're completing their education. So the purpose is to be a bit of a living document, like I said, and we just continue to add to it as we learn more about what that looks like and kind of best practices for that. So that kind of happened throughout the year. And as part of that, that action plan, this roadmap for high school students was kind of a key deliverable of that. And like I said, bursary, scholarship, and grant information, key contacts and programs. So it's really meant to be this comprehensive map that youth can pick up and be able to kind of navigate and explore what that will look like to be able to gain a meaningful career in healthcare. And so that was developed earlier this year, largely led by NRM staff and the great work that they're doing. Next slide. And so every now and then we have some requests from the group that are outside of the objectives. And so one of those was a palliative care pamphlet. There were a few of the members of the steering committee that really felt strongly that there isn't always the clearest information around how people who might require palliative care resources, there's not something that has all of those kind of resources and numbers and contacts that was, you know, all together and in a way that was easy for people to access. And so it was requested of Urban Matters to compile all of the kind of resources and different programs that were available into and kind of information summary pamphlet. And the idea was that it could be printed off and kind of ready, you know, at various health centers or even the town hall, or it could also be online that people could be accessing and then clicking through and making some of those links live. So it would be kind of dual purpose there. So that was completed in March of this year. And I think it's just being kind of double checked by Northern Health, and then will be shared very shortly. Next slide, please. And so all of that, other than the palliative care summary, was all around that first objective, the recruitment and retention and growing our own. And so this piece, kind of the next few slides, are all about how we work towards the second objective, which was the improving healthcare travel services and advocating for increased access to health travel. And so there was a survey that was developed and taken by residents in 2019. And so our goal this year was to update the survey and just kind of see if there were any trends or changes that occurred between 2019 and now in terms of how people were spending their time and money on traveling for healthcare, what they were like, how many times they would have to travel, how many times they were able to access healthcare without having to travel. And so just really wanted to get that updated snapshot of what that looked like to be able to inform an advocacy plan, which is what I will talk about on the next slide. But yeah, we had a survey summary that was very visual, and we wanted, you know, when we engage with the community, we want to make sure that we share back what we learn from them, because that's a key thing when you're getting input. You want to make sure people feel heard and that they see where the information is going. So we made sure we had a real visual document that could be shared back. And so this advocacy plan, I think this is a really important and key deliverable that was developed by the group. And so, yeah, that updated survey information went into this advocacy plan, but then a lot of research around improving access to some of these non-emergency health travel services was undertaken to be able to create this advocacy plan. So it really outlines key recommendations to be able to advocate for the NRM to improve their health travel services. And the main purpose of this was to be able to be shared with key partners, to be able to advocate to Northern Health and the province around what the NRM wants to see in terms of moving forward and being able to have better access. So information around accommodations and transportation, meals and support systems. So kind of what is the current landscape, and then where the community wants to go, or where there's opportunities. And, you know, that can be different things like different contracts or shared services around like air travel, or looking at kind of innovative ways that other places are doing for some of these health travel services. So the advocacy plan is a key document that I think the group will be using moving forward, especially in conversations with higher levels of government. And so that was finalized in March as well. And then also out of some of the work around non-emergency health travel, there was an existing resource that the NRM had around sharing to residents what kind of was available for medical travel for Northern Rockies patients. And so following the development of the advocacy plan, it was felt that some of the resources available and information on accommodations and travel assistance and things like that should be updated. So we worked together as a group to update that resource that was then shared out as well. So that was part of some of that work that finished in March. So I think that was, so yeah, I feel like there was a lot that got accomplished, and a lot of kind of deliverables that are really key for the community, and I think, again, should be really celebrated, and really, again, wanted to emphasize that I think this is really unique and special for local government to really focus and put resources towards, and put so much energy and like staff energy into it. And so yeah, this next year, the group is looking forward to continuing efforts on focusing on growing your own for the Northern Rockies Regional Municipality, and as well as advocating for increased access to non-emergency health travel services. So the group feels that pushing, both of those forward still, with some of the pieces that were accomplished towards the end of the year, making sure that they reach the right people and that they continue like the working documents to be added to. But then because it's such a related topic, I think increasing visiting health services and virtual care was the kind of next natural one to focus on, seeing that it can really align with the increasing access to health travel services. Like what can we bring to the community, and what can we provide virtually, so that people don't have to travel as much. And then outside of those main objectives, a couple of the main things. So we don't actually meet over the summer. So July and August, the group kind of breaks for summer, and so that everyone can have their well-deserved vacations and not have to meet on Friday morning at 8 a.m. during those days. But in the absence of having meetings, Urban Matters has been tasked with creating a visual guide detailing services that can be provided through a medical clinic versus those which require hospital visits. So kind of similarly to when the pharmacy was able to offer certain services, a kind of a bit of a guide on what those services could be, so that we're not always having people go to the hospital for things that can be addressed through the medical clinic. And then part of that visual guide would also be what happens when people make appointments but then don't show up for them, because there was a feeling that people were seeing that more and more around medical appointments and people not going to them. So how that impacts the flow of medical treatment. And then the other thing that we've been tasked with is to just research into other funding opportunities. So knowing that this group is funded by this tripartite agreement, and it's really great funding to get some of these initiatives moving and completed, but can we leverage to be able to access other funding so that there's more opportunity to undertake some of these initiatives. So we will be doing that over the summer as well. Next slide. I think that is about everything from me, but I welcome any questions or comments about the work that we've completed as a group, and the work that we have yet to complete as a group. So thank you.
Well, thank you, Julianne, for the presentation and all the work that you've been doing with the committee. I certainly appreciate that. So I'm going to open it up to anybody who may have a question or a comment. Please.
Hi, it's interesting because the BC Rural Health Network just today published their paper on improving improving travel services throughout the province. And I'm sure you'll check it out, but when you read their paper, it is so mirrored with our paper. So neither one of us are off track at all. Everybody across from the province is speaking from the same songbook. So yeah, very well done. Thank you.
Thank you for that.
Any other comments, questions? So I read through it. There's a lot there. There's a lot there. And again, like Julie, I felt that information that I had, her report, information that we've been talking about, all the meetings, all the different things that people are telling us. I've been kind of around the outside because Councillor Gerwing has really been focused on leading this health initiative that we have. But I felt a lot of it was being focused into this report that you've put together for us. And so I could relate to it. But I wonder, when it comes to Advocacy 101, I don't know that a minister will read this. Great information, background information available for their staff. If there was something like you did with the survey. So you put it into pictograms, right? And you boiled it down into just a page or a couple of pages there. If we had something like that, that was a 2-page thing that the minister could flip and have all of those impacts, negative impacts that travel is having on our residents, all of that good information sort of boiled down, I think that would be something we could really take and put in front of the minister at UBCM or anywhere else that we might be able to do that. So I don't want to overburden you for the summer, but if that's something that we could ask for, I think that would be really good.
Yeah, no, I love that. And I feel like we had always talked about like a bit of an executive summary being obviously a key, excuse me, communication tool, and kind of what you're saying around like, can it be like a visual, really like telling executive summary, like you say, with some infographics, with some numbers, so that it's like much more easy to digest and communicate out. So yeah, I like that idea. And actually, it was funny. I was thinking about this morning that at UBCM they have those like workshops and things, and you know, I keep saying this is a really unique thing for a local government to be focusing on, and I almost think like, because I've been going to UBCM, I'm like, we really should have put in like a talk and like had myself and some of your staff talk about how like the great work that's been done, and it could almost be like an example for other local governments, especially rural ones, because I think what you guys are all doing is kind of cutting edge, right? So I just think kudos to everyone for really focusing and prioritizing. So yeah, maybe a next year thing, maybe a next year clinic at UBCM.
Yeah, well, we did a presentation to NCLJ.
Right, of course you
right?
did.
And,
Yeah.
Yeah, and that I hear that went over really good. It's a bit of a
Yeah.
double-edged sword, right? Because of the other side of the coin, which is this is not for municipalities. So when some municipalities are taking the lead and going ahead and doing it, you get some criticism from others who are saying this is a bar that we can't maintain, and you get that whole debate that happens. But I think generally you're right. It's unique, and it's we're taking a planning perspective. I guess the other side of it is our frustration with actually being able to get the Northern Health and the ministry to actually act on some of this. The Grow Your Own is fantastic because we have complete control over that, and we're seeing results from that. But some of these other initiatives that we're trying, we just keep bashing our heads against the wall. Go ahead, Lorraine.
Yeah,
please.
so just in response to that, I did notice, I forget where I read it, but Chiro had made a quote that the province really needs to step up to provide travel assistance to rural and remote residents to get to where they need to go. So I think that like that is just a huge step forward. And they're not the only health authority that is beginning to talk like that. So I think that all of this work is being seen and being heard. And I really appreciated tonight's presentation because as a committee, we really wanted to inform council as to, because I come and I give my little report, but nothing like what has been created here. So you have a really huge understanding of the work that has been done over the 8 years. And it's a great reminder for us too, because, it's so slow. It's just so slow, but hearing, Chiro say that the province really needs to look at like that was, I feel like a huge moment. I can retire now.
Yeah. Well, and I mean, to add to Councillor Gerwing's point about like this is the first kind of presentation, like I think we've talked about as a committee, like we probably should have done, this council presentation like in a more robust way sooner. And like, we want to continue to make sure that you are apprised of when we have created a really meaningful advocacy document, or of course, like at the end of the year, kind of a recap again. So we'll make sure that we're doing that and prioritizing that so that we can share all the great work that's going on.
Okay, well, thank you very much for your
Thank you.
presentation and your time tonight, for
Of
hanging
course.
in here with us at the end of your day.
Yeah,
So
my
we'll let you
pleasure.
go with our thanks, and certainly appreciate you attending tonight.
Perfect. And we'll make sure we get that executive summary, the visual one for you for the fall. So,
Perfect.
okay,
Thank
thanks
you
a
very
lot,
much.
everyone. Good night.
Yeah. Okay, that brings us to reports. So there is a report there for our information. I guess it's the, did you want to speak to the report? I see you're gonna get up and leave. Would you just?
Wow.
Yeah,
I was going to introduce Julianne and the report was kind of to back up her presentation, so I didn't really.
yeah.
Okay.
Yeah, it's there for our information.
Yeah.
It's, you know, it's really good. It's good report, and it puts a lot of the detail behind what she's told us. So thanks for your work on this.
Thank you.
You're welcome. Okay, there's no new business. Is there anybody online who wishes to ask a question? Anybody come on? No? Okay, then we will adjourn until 6:30. Thank you very much.